Okay. All right, let's get started. All right, Samantha?
Yes.
All right. I'm Josh. I'll be your PTA today. So I heard you had surgery on your left hip, had a femoral ORIF done. Okay.
Yeah.
So, gonna check with a few things. Let's see how that incision site is doing. Gonna check for infection to see how it. Oh, I'm stuck. Okay. Okay, we look like we're doing good here. No signs of infection. Let's check for edema in the legs. No. Okay, so some slight pedal edema in one of the feet, but otherwise circulation seems pretty good. Sam, how are you on pain? Are you feeling scale of 1 to 10?
Normally like a 2, but
Okay.
if I start moving, it goes up to like a 6.
Okay, so a 2 at rest and up to a 6 with exercise or with movement. Okay, I'm going to check your heart rate and your blood pressure. I can have your hand, please. Right here. Okay. So heart rate and respiratory rate are within normal limits. Okay, we don't have a blood pressure cuff, so I'm gonna assume that we would do that because we have all the equipment in a real setting. Moving on. Okay, so since pain and everything are good, the only contraindication we have is we don't want you bearing any weight on that left leg. Also, as we get into bed mobility, we don't want putting any weight on that hip, or we don't want to put added pressure on the hip. So normally we would have you turn to a side and then go from a supine to side and then a side to a sit, but we don't want her putting pressure on her affected leg by kicking that foot up. We also don't want to put pressure on the wound by rolling to that side. So what we'll do today is, if you can get your elbows up underneath you and put your hands down and push up, and we're gonna have you scoot a little closer to this side. So there's that, and I'll help you move here. There's that, and swing this leg off, and I'll guide this one as you press up onto your hands and turn. Perfect. How are you feeling? Feeling okay?
Yeah.
Not too dizzy? Yeah, we'll just sit here for a minute so your blood pressure can regulate. Then, as I get my gait belt, we're gonna do some mobility and things. So we've done a supine to sit. Now we'll do a sit to stand here in a minute, and I'll demonstrate. Thank you, Samantha. Is that too tight?
Yeah.
Okay, great. I'll just put the extra stuff so we don't give you a tail. Okay, so before we get started, I'm going to demonstrate real quick. So we'll have you go from here, from our seated position. Keep your hands underneath you on the table there, so your pressure's on your hands and your non-affected leg. We don't want any weight on this, so I'm going to move the walker out in front of you. So I'll move it in front of me real quick. So I can press up, get my weight firm on that foot, put my knees over, and get to where I'm stood properly. My weight's on my feet, and then I'll grab onto this. I don't want to reach forward and press up this way because a risk of losing our walker. So press up here, and then we'll do a quick demonstration of gait training. So up here, up here. Okay, slide this forward, pressure on the walker, non-affected leg slides forward or moves forward. Okay, so here, make sure we keep this non-affected leg, your hurt leg, your affected leg, keep it bent. We don't want any weight on that, okay? Okay, let's get you through it now. And I'll be here on your left side so I can help guide you a bit. So pressure there on the table. Good. Stand up. Perfect. Okay, you ready to do some walking?
Yeah.
Okay, slide forward. Perfect. Great. Want to cut it?